Coming up next, we're going to talk about biologics. If you have rheumatoid arthritis and your condition is not getting better or it's getting worse, you may want to consider this treatment.
This pain topic is brought to you by the Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or online at carrascopaininstitute.com.
I'm Dr. Carrasco.
I'm Dr. Alex DeJesus.
We've been talking about painful conditions. We're talking about a very common situation now, rheumatoid arthritis. It's a terrible, debilitating disease. And Alex, I see a lot of patients come to see me who have pain all over their body. Part of it's because they have low back pain that I can treat, but some of them have rheumatoid arthritis. How do you treat that?
You know, most patients with rheumatoid arthritis are going to require a combination. They require to be on some kind of pill medications. You know, the average is 3 or 4 medications. These patients are not just on 1 or 2 pills. And even at that, your chances of doing really well is like 15 or 20%. So 80% of the patients need to move to the next step. And the next step is to be on a biological.
You know, a lot of patients, when they come to me, they're not taking anything. It's surprising. Their fingers look horrible. They're all deformed, and they're not taking the medication. So why aren't you taking your medication? They said, because they're not working, and I'm tired of them. I'm worried about my liver. I'm worried about everything else. I don't want to take it anymore.
You know, taking 4 or 5 pills, you know, a day, different pills, it's not that fun. And if they don't work, I can understand how the patient is discouraged and they're going to stop the medicine. But a biological is not a chemical. A biological is not a kind of medication or chemical. Therefore, it's not going to go through the liver. It's not going to go through the kidneys. It's not going to affect your blood pressure or your blood pressure pill, your diabetes or your blood sugar. It's not going to make your cholesterol go up. You know, for the most, these are things that mimic your immune system and work in a very, very safe way, in a very, very great anti-inflammatory medications.
Patients are afraid of biologics. And they come to me and says, I don't want to go there. I had a patient recently that said, I don't want to take the biologics. Why do you think they're afraid?
The most common side effect of being on a biological is a slight tendency for infections. For example, if you're not on a biological, just rheumatoid patient, 5% of patients a year are going to have a sinusitis or bronchitis. 5%. Okay?
Without it.
When you add the biological, it goes up from 5 to 7%.
That's not bad. 2%.
It's a 2% increase. But that is the most common side effect. That's more than 1% that some people are going to experience. The second common side effect, if you're on a biological that's a little shot under the skin, that could be an ouch factor. Or if you're in a biological that goes in an infusion in the office for an hour to 3 hours, there can be some discomfort with the infusion. But that's it. Everything, all the other side effects are 1% or less. Extremely rare.
I mean, I believe that they're safe. How does it happen? What do you do? How do you give the medication?
So a biological, you will come to the office and most
likely... It's a liquid biological?
It's going to be a liquid biological in an IV bag. And most likely you will have to have an IV catheter for 1 to 3 hours, depending on which biological it is, or up to 5 hours for some biologicals. And you will do that on an every 6 to 8 week basis. So basically it's an ongoing treatment. It's not I do well and I don't show up. It's an ongoing treatment. Now, there are new medications, and the patient's a little bit confused. They think these are biologicals that are pills. Those are not biologicals. They're called small molecules. They're not cortisone. There are new breed of medications that also have great efficacy in helping the patients with rheumatoid arthritis.
So you think it makes a difference? It stops the disease, biological? That's what I try to tell my patients. It's going to stop the disease.
You're going through an 80-20. 20% is the best number you can get, that you're going to control the disease on pills alone. When you go on the biological, you're looking at a 70 to 80% patients that control the disease. You're looking at a great improvement. The patients can do what they want to do. They can work full time. They can play with their grandkids. They can still do their sedentary, mild sports. They come back to life.
Well, there you have it. He thinks biologics are safe. He thinks they help improve the quality of your life and overall make your life much more enjoyable.
This pain topic is brought to you by the Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or online at carrascopaininstitute.com.